Welcome back to Long COVID Doctor, an educational series for Long COVID sufferers. I'm Dr. Tim Robinson, formerly a family doctor, GP for 30 years, and now working in Long COVID Services for 5 years. I post on podcast channels and YouTube. I hope you find my postings helpful. If you do, click subscribe. Let's spread the word. Thanks for any feedback. Apologies though, no replies from me. I just haven't got the time. However, I do appreciate them all the same. They help me with my future postings. Another apology, important though, my usual disclaimer. Any advice or treatment I mention should only be considered after discussion with your own doctor. So, this talk is all about gut problems in long COVID. I've divided it up into 2 parts to make it less overwhelming and less tiring. In part 1, I will cover the symptoms, their causes, and in part 2, I'll cover the treatments and strategies to help. So here we go. Gut problems in long COVID. So what are the problems that patients are experiencing? What are our patients telling us in the clinics that I work in? Well, it comes down to lower gut, lower gastrointestinal problems and upper gastrointestinal problems. So let's start with the commoner of the two, and that is the lower gut problems. And I suppose the commonest symptom that patients are reporting to us is the variable bowel habit since they had COVID and now part of their long COVID. Variable in the sense of varying from loose diarrhea to constipation. Passing often semi-formed motions, often with some colicky abdominal pains, often with urgency to open the bowel. There may be accidents even, the need for wearing pads. Patients sort of restrict when they go out. They find themselves almost sort of becoming housebound, or certainly dietarily restrict themselves, or basically don't eat and drink before going out because that can often trigger a bowel action. There's usually excessive wind, there's bloating and distension of the abdomen. And those patients who have a history of irritable bowel syndrome before they had COVID/long COVID, their irritable bowel syndrome basically gets out of control. It's worse than they've ever had it before. Likewise, patients who have had inflammatory bowel disease, such as Crohn's disease or ulcerative colitis. Again, since having COVID and now with their long COVID, their IBD, inflammatory bowel disease, Crohn's, ulcerative colitis, is so much worse. So that's the lower gut, lower gastrointestinal tract covered, the symptoms that patients are reporting to us. What about the upper gut, the upper gastrointestinal tract? So basically from the esophagus, the gullet, down into the stomach and the upper small intestine. So a lot of patients are complaining of indigestion and heartburn and sort of burping and sort of acid coming up into their mouth, sort of a salty, like watery liquid. Patients often complain of a discomfort in the sort of the upper abdomen, so just below the bottom of the sternum, in the sort of the soft bit, the solar plexus bit. Patients are experiencing sharp burning pain. Patients also experiencing nausea. With these symptoms, both upper and lower, some patients are saying just that they've had changes in their weight, either increase in weight or reduction in weight for various reasons. The other big complaint that a lot of patients have is food intolerance. Intolerance to various foods that they've never had before. Typically, they'll say, well, look, before COVID, I could eat anything and nothing disagreed with me. But since having COVID, I can't have this and that. Or, specifically, it's usually, say, wheat or dairy. So ever since then, the wheat and dairy seem to trigger symptoms. Those lower gut ones, particularly loose motions, semi-formed motions, and also sort of indigestion. So, what should you do if you have any of these gut-related symptoms with your long COVID? What should you do? Well, of course, it's common sense. Something new with your health, it's not right, that you've never had before. What do? You obviously report to your doctor. Either contact on the phone or make an appointment to see your doctor. And this is important, of course, because anything new, health-wise, that's not quite right, you're probably going to want to have corrected and sort of eliminated. But also, you're going to be wondering, but why? What is this, and what could it mean? So the reason I mention this is that it's really important, even though you have got long COVID and you've got a new symptom or a number of symptoms, you can't necessarily say they are related. They may be there just by coincidence. Okay, you've got long COVID, but actually this new symptom may be nothing to do with your long COVID. It may be a standalone symptom of its own. So we mustn't be what we call COVID blind. Or because you've had COVID, we can't put symptoms necessarily down to the COVID. So safety first. Let's not be COVID blind. Let's look at what you are presenting and figure out what it is. Get to the cause of it. And, like I said, a GP will do this. And the usual sort of procedure is to visit the GP, tell the GP your symptom. GP will then ask all the different features relating to that symptom and the things that relieve that symptom, the things that make it worse, any other symptoms. GP will probably want to examine you. And then probably move on to blood tests, looking sort of the blood panel, looking at sort of how well your blood cells are functioning and your liver's functioning, your kidneys are functioning. Just general blood screening. That may then lead the GP to ask for other tests. So, thinking this is a presentation on gut problems, so they may, and we've talked about one of the common symptoms is a change in the bowel habit. So basically, the GP may ask for a sample of your stool to send off for a fecal calprotectin to look for inflammation of the bowel. Likewise, the GP may ask for a stool sample to do what's known as a FIT test to look for blood in the stool. GP may request an abdominal ultrasound to look at the state of your liver and your gallbladder. So, if some of those symptoms are upper gastrointestinal, they seem rather, indigestion, acidic, reflux, the GP may request an endoscopy. If, however, the bowel symptoms are more what troubles you, then the GP may request a colonoscopy. So a scope up the tail end, into the colon, to look for anything sinister. And this brings me to the other thing that the GP is basically doing, and that is looking for red flags. What's a red flag? A red flag is a symptom or sign that is suggestive of something more worrying. So, for example, I talked about weight loss. That is a red flag because we ask ourselves, well, why is someone losing weight? And that could be something sinister. It could be a cancer, couldn't it? Or blood in the stool. Again, thinking now, bowel, is it a bowel tumour? Or mucus. You can get a papilloma, or basically an adenopapilloma, basically a growth in the bowel which secretes mucus. Again, these are all symptoms that we would consider as red flag and need to be investigated because we need to exclude the possibility of a cancer. Turning now to the upper gut, severe pain. I talked about pain in the solar plexus that some patients get with indigestion. But if it's severe, obviously we wonder whether that is severe enough to suggest a ulcer in the stomach or in the duodenum. So the patient, so the GP would want to be taking that seriously and probably requesting an endoscopy or a referral to a specialist. And that goes for all those other symptoms, the lower bowel, the change in bowel habit, any of the red flags symptoms. Then the GP would obviously refer you to a gastroenterologist or a surgeon who knows all about the large bowel. So those are the symptoms. And, what we should do if you have symptoms. Not be COVID blind, take them to the doctor, and let's find out what to do thereafter. That then leads to, if all those investigations have not revealed anything sinister, and hopefully they have not, and the red flags are not actually an underlying cancer, and we've excluded anything nasty, then it leaves us with the diagnosis of the gut symptoms due to your long COVID. Right, great. So we feel comfortable now, we can proceed. So that leads us on to that question of, what are the causes of gut problems in long COVID? Okay, well, there are a number, of course. But then again, you're probably not surprised because, after all, and I keep going on about this in my other podcasts, we know long COVID is a multi-symptom, multi-causal, multi-symptom, multi-system illness. Disease. So therefore, of course, gut problems in long COVID are probably going to have a number of causes, and they do. The commonest cause, however, is something called mast cell activation. MCAS, you might have heard of being sort of talked about, or you might have read up. Mast cell activation, MCAS standing for mast cell activation syndrome. This, in my experience, as I say, working in long COVID over the last 5 years, is probably the commonest cause for both upper and lower gastrointestinal symptoms, as well as food intolerances. So, mast cell activation, what's it all about? Well, basically, it's part of the hyper-inflammatory response, the excessive inflammatory response that is mounted to the initial infection with your acute COVID illness. What's a mast cell, you may well ask? Well, a mast cell is one of the many cells that goes to make up the innate immune system. So the innate immune system is the first line of defense against invading viruses, bacteria, foreign particles. So the innate first line. And mast cells are one of the many cells in that innate system. And mast cells are throughout the whole body, all the tissues, okay? All the tissues throughout, but particularly highly densely concentrated in the gut and the skin and the airways. Mast cells are quite large cells, and they contain many what we call pro-inflammatory mediators. They mediate, they encourage inflammation. And the reason why we need to do this is because if there's a foreign invader, we need to attack that invader and bring about a response that draws all the different cell types to that virus sitting there, and to basically kill it, get rid of it. So mast cells have these chemicals within them that set up inflammation. And there are anything up to 1,000 of these different mediators within a mast cell. And the mediator that is there in highest concentration, the most of, is histamine. So, mast cell activation, as I say, that is probably the commonest cause of your long COVID gut problems, both upper and lower. But like I said, there are other causes for gut problems in long COVID: dysautonomia, autoimmune problems, and gut dysbiosis. So dysautonomia, you'll probably remember, is the imbalance of the sympathetic nervous system and the parasympathetic nervous system, the two parts of what we call the autonomic or automatic nervous system. So this has many different sort of presentations, many different symptoms associated with it. Again, listen to the podcast on dysautonomia just to get yourselves upskilled on that one. But the element, now that we're talking about gut problems in long COVID, the element that is most troublesome in dysautonomia is nausea. There are others, of course, but in a way they overlap. Just thinking of the parasympathetic nervous system, the rest and digest part of the autonomic nervous system. So remember, rest and digest. So the parasympathetic nervous system is really important for both secretion of enzymes through the small intestine, and also the motility, the movement of what we call peristalsis. That's the movement of the contents of the gut through the intestine. So dysautonomia, dysfunctional parasympathetic or autonomic nervous system. So therefore, that will contribute to, I talked earlier about irritable bowel syndrome, that will contribute to the irritable bowel system and symptoms of bloating and excessive wind and gurgling and colicky pains, because your parasympathetic is not working so well because of this thing called dysautonomia. The nausea, though, of dysautonomia is very troublesome for quite a few patients, and that's sort of an overwhelming, continual low-grade feeling of sickness. So dysautonomia, that's one of the causes of the gut problems. Then there's autoimmunity. Okay, so what do we know? What do we mean by autoimmunity? Well, basically, it's when the immune system, whose function is to attack invaders, starts to attack ourselves. Okay, autoimmune. Okay, auto as in ourselves, and immune system. So an example of this is celiac disease, and we have seen an increased prevalence of newly diagnosed celiac disease in since we've had long COVID over the last 5 years. So, autoimmune problems, and we know in other parts of long COVID, autoimmunity is a cause for a number of other symptoms of long COVID. And then the final cause I've listed here for the gut problems in long COVID is gut dysbiosis. And what do we mean by gut dysbiosis? Basically, we all know about the friendly bacteria in our large intestine, in our large colon. And it sits there and has lots of functions. We also know that in long COVID, the gut bacteria are not so friendly, or the balance between friendly and unfriendly is not as good as it could be. So it's less friendly. Microbiota, the bacteria in our gut, is really, really important for so many functions. But when it's not as friendly, then absorption's not as good from the large bowel. The large bowel lining can become leaky. One of the functions of the microbiota is to produce neurotransmitters. One of them is serotonin, which is made in the gut, in the large bowel, is absorbed into the circulation, and then concentrates itself up into the brain. So your serotonin levels reduce. And this is not good news, because low serotonin levels leads to depression, mood disturbance and depression. So those are the sort of, if you like, underlying causes. I'll just recap: mast cell activation, dysautonomia, autoimmunity, and dysbiosis. But remember, the commonest is this mast cell activation. So I hope that's helpful, and I've explained that at a sort of slow pace and as clearly as possible. That brings me to the close of this part one of my talk on gut problems in long COVID, what our patients are experiencing and their causes. So in part two, I'll talk about, how are we going to tackle them? How are we going to tackle these problems? And I'll cover the treatments and strategies. So, see you there.